Question 1. A postoperative client becomes suddenly restless, tachypneic, and reports chest pain. Which action should the nurse take first to apply clinical judgment using ABCs? A. Administer prescribed morphine for pain. B. Elevate the head of bed and apply high-flow oxygen. C. Call the rapid response team after documenting vital signs. D. Obtain a stat chest X-ray requisition. Answer. B. Elevate the head of bed and apply high-flow oxygen. Rationale. Airway and breathing are prioritized when pulmonary embolism is suspected. Elevate HOB and oxygenate immediately to prevent hypoxemia. A treats pain but not the life threat. C is appropriate after immediate stabilization. D is necessary but not before oxygenation. Question 2. During initial assessment of a client with suspected sepsis, which data point most directly drives the nurse's next clinical decision? A. WBC 11500 per cubic millimeter. B. Lactate 4.2 mol per liter. C. Temperature 38.2 degrees Celsius. D. BP 130 over 84 millimeters of mercury. Answer. B. Lactate 4.2 mol per liter. Rationale. Elevated lactate indicates tissue hypoperfusion guiding urgent fluid resuscitation and cultures. A mild leukocytosis and fever are nonspecific. D is normal and less urgent. Question 3. A nurse must choose an initial nursing diagnosis for a COPD exacerbation client with respiratory rate 30, SpO2 86% on room air, and accessory muscle use. Which diagnosis best guides the plan of care? A. Activity intolerance. B. Risk for infection. C. Impaired gas exchange. D. Knowledge deficit. Answer. C. Impaired gas exchange. Rationale. Manifestations point to ventilation, perfusion issues. This diagnosis directs oxygen, bronchodilators, and positioning. A, B, and D may be relevant later, but are not the immediate priority. Question 4. A client with DKA is receiving IV insulin. Which assessment finding requires the nurse to adjust the plan immediately to prevent a critical complication? A. Potassium 3.0 milliequivalent per liter. B. Glucose 320 milligrams per deciliter. C. pH 7.28. D. Urine ketones positive. Answer. A. Potassium 3.0 milliequivalent per liter. Rationale. Insulin drives potassium into cells, worsening hypokalemia and risking arrhythmias. Replace potassium ion per protocol before or with insulin. B, C, and D are expected early DKA findings. Question 5. Which task is most appropriate for the nurse to delegate to a trained UAP when implementing fall prevention strategies for a high-risk client? A. Perform a focused neuroassessment. B. Educate the client on anticoagulant risks. C. Apply a gait belt during assisted ambulation. D. Titrate bed alarm sensitivity. Answer. C. Apply a gait belt during assisted ambulation. Rationale. UAPs may perform standard, non-invasive tasks with training, ambulation with gait belt. A and B require nursing judgment or teaching. D involves device setting decisions requiring RN oversight. Question 6. A nurse receives SBAR about a client with chest pain. Which clarifying question best strengthens clinical judgment before implementing orders? A. Do you think it's cardiac? B. When did the pain start and what relieves it? C. Are they anxious? D. Can I get a meal tray ready? Answer. B. When did the pain start and what relieves it? Rationale. Onset and modifying factors refine differential, ACS versus other, and timing of interventions. A is opinion-seeking, C is nonspecific, D is inappropriate in acute chest pain. Question 7. A confused client repeatedly pulls at IV tubing. Which least restrictive evidence-based intervention should the nurse implement first? A. Apply bilateral wrist restraints. B. Place mitts and tie to bed frame. C. Use a sitter and cover lines with protective sleeves. D. Administer PRN sedative to stop agitation. Answer. C. Use a sitter and cover lines with protective sleeves. Rationale: least restrictive, person-centered measures come before restraints or sedatives. A and B are restraints requiring last resort use. D carries delirium and respiratory risk. Question 8. A client refuses a blood transfusion for religious reasons despite hemoglobin 5.9 g per deciliter. Which action best balances ethics and safety? A. Transfuse due to life-threatening anemia. B. Notify the provider and explore acceptable alternatives. C. Ask family to override the refusal. D. Discharge the client AMA immediately. Answer: B. Notify the provider and explore acceptable alternatives. Rationale: respect autonomy with shared decision-making, e.g., EPO, iron, volume expanders, and document informed refusal. A violates autonomy. C lacks legal standing. D is unsafe and premature. Question 9. While reconciling medications on admission, which discrepancy should the nurse address first to prevent harm? A. Omission of home multivitamin. B. Duplicate lisinopril orders. C. Missing PRN acetaminophen. D. Change in statin brand. Answer: B. Duplicate lisinopril orders. Rationale: duplication of antihypertensives risks hypotension or AKI. Resolve now. A and C are low risk. D brand change is typically equivalent. Question 10. A postoperative day. One client reports 8 out of 10 pain. Which stepwise clinical judgment action should the nurse take after confirming vital signs are stable? A. Provide non-pharmacologic methods and reassess. B. Administer prescribed opioid per order set. C. Call the provider for a new order first. D. Document and reassess in 4 hours. Answer: B. Administer prescribed opioid per order set. Rationale: with stability and appropriate orders, implement analgesia and then evaluate response. A can be adjunct but not sole therapy at 8 out of 10. C is unnecessary before trying available orders. D delays care. Question 11. During triage of 4 clients, which client should the nurse see first using high acuity prioritization? A. Asthma client with mild wheeze and SpO2 94%. B. Stroke client with new slurred speech at 45 minutes onset. C. Vomiting client with mild dehydration. D. Ankle sprain with swelling and pain. Answer: B. Stroke client with new slurred speech at 45 minutes onset. Rationale: time-sensitive thrombolysis window demands immediate evaluation. A is stable. C and D are non-emergent. Question 12. The nurse evaluates a heart failure client after 4 diuretic, which finding indicates the plan is effective and safe to continue. A. Potassium 3.2 milliequivalent per liter. B. Weight decrease 1.5 kilograms and improved crackles. C. BP drop from 138/84 to 92/60 millimeters of mercury. D. New dizziness on standing. Answer: B. Weight decrease 1.5 kilograms and improved crackles. Rationale: diuresis should reduce edema and pulmonary congestion without hypotension or electrolyte derangement. A suggests hypokalemia. C and D indicate overdiuresis. Question 13. A client with suspected meningitis needs antibiotics. Which sequence best reflects evidence-based decision-making? A. Give antibiotics, then obtain blood cultures, then send to CT. B. Obtain blood cultures, give antibiotics, then lumbar puncture as ordered. C. CT scan first, then cultures, then antibiotics. D. Wait for LP results, then start antibiotics. Answer: B. Obtain blood cultures, give antibiotics, then lumbar puncture as ordered. Rationale: cultures before antibiotics preserve diagnostics. Antibiotics must not be delayed. LP follows once safe. C and D delay therapy. A risks contaminating cultures. Question 14. A nurse witnesses a colleague documenting an assessment not performed. Which action reflects legal and ethical responsibility? A. Confront the colleague loudly at the nurse's station. B. Ignore it to avoid conflict. C. Report the incident per policy and complete an objective note. D. Tell the client what happened and suggest a lawsuit. Answer: C. Report the incident per policy and complete an objective note. Rationale: falsification is reportable, follow chain of command and policy. A is unprofessional. B violates duty to protect clients. D is inappropriate and outside scope. Question 15. A client on heparin infusion has a PTT of 120 seconds with oozing at the IV site. What is the nurse's best immediate action? A. Stop the infusion and prepare protamine per protocol. B. Slow the infusion by 50% and reassess tomorrow. C. Continue infusion and increase frequency of vitals. D. Remove the IV and discharge home. Answer: A. Stop the infusion and prepare protamine per protocol. Rationale: critically elevated PTT with bleeding requires holding heparin and considering reversal. Notify provider. B and C risk hemorrhage. D is unsafe. Question 16. A newly admitted older adult with pneumonia is drowsy and coughing weakly. Which implementation best reduces aspiration risk during meals? A. Provide thin liquids with a straw. B. Position upright at 90 degrees with small, supervised bites. C. Encourage rapid eating to finish before fatigue. D. Offer large sips to clear secretions. Answer: B. Position upright at 90 degrees with small, supervised bites. Rationale: upright positioning, pacing, and supervision reduce aspiration. A and D increase risk. C worsens fatigue and safety. Question 17. The provider orders 2 mg for hydromorphone for an opioid-naive client with OSA. Which action demonstrates sound clinical judgment before administration? A. Give the dose and document effect later. B. Verify dose appropriateness and clarify for a reduced dose. C. Refuse to medicate due to OSA. D. Substitute oral acetaminophen without an order. Answer: B. Verify dose appropriateness and clarify for a reduced dose. Rationale: OSA and opioid-naive status increase respiratory depression risk. Seek clarification for lower dose and monitoring. A. Ignores safety. C. Is obstructive. D. Is medication error. Question 18. A family insists on CPR for a client with a valid DNR order. Which response best upholds ethics and communication? A. We must follow your wishes. B. I will start compressions now. C. The client's DNR guides our care. Let's discuss comfort-focused treatments we can provide. D. The DNR is just a suggestion. Answer: C. The client's DNR guides our care. Let's discuss comfort-focused treatments we can provide. Rationale: respect client autonomy and legal directive while offering compassionate alternatives. A, B, and D contradict the DNR and legal standards. Question 19. During interprofessional rounds, which statement from the nurse most effectively uses closed-loop communication to prevent error? A. I think the labs are fine. B. You said potassium replacement 40 milliequivalent PO now. I will administer and recheck BMP at 1,600, correct? C. I'll do what you think is best. D. Let's see what happens first. Answer: B. You said potassium replacement 40 milliequivalent PO now. I will administer and recheck BMP at 1,600, correct? Rationale: restating orders with timing and confirmation reduces miscommunication. A, C, and D are vague and risk omissions. Question 20. A client receiving vancomycin reports ringing in the ears and new imbalance. Which evaluation step should the nurse prioritize to guide next decisions? A. Assess trough timing and level, then hold dose and notify provider. B. Offer earplugs and continue infusion. C. Increase the infusion rate to finish sooner. D. Add PRN meclizine for dizziness. Answer: A. Assess trough timing and level, then hold dose and notify provider. Rationale: ototoxicity is a serious adverse effect. Verify levels, hold medication, and collaborate for dose adjustment. B, C, and D ignore potential toxicity and delay appropriate action. Question 21. A 16-year-old with cystic fibrosis reports worsening shortness of breath despite adherence to routine chest physiotherapy. What is the nurse's next best action? A. Encourage additional physiotherapy sessions only. B. Obtain sputum culture and notify provider for possible antibiotics. C. Increase pancreatic enzyme dose before meals. D. Recommend increased caloric intake. Answer. B. Obtain sputum culture and notify provider for possible antibiotics. Rationale: a sudden respiratory decline in CF often indicates pulmonary infection. Culture directs antibiotic therapy. A alone may delay treatment. C and D address nutrition, not acute respiratory decline. Question 22. A client with CF on IV tobramycin reports decreased hearing and dizziness. What is the priority nursing action? A. Continue therapy and document symptoms. B. Hold the medication and notify the provider immediately. C. Suggest meclizine for dizziness. D. Reduce fluid intake to limit toxicity. Answer. B. Hold the medication and notify the provider immediately. Rationale: ototoxicity from aminoglycosides requires immediate hold and provider notification. A delays care. C. Masks symptoms. D. Worsens renal clearance. Question 23. The nurse is teaching a CF adolescent about infection prevention in a CF clinic. Which statement indicates the need for further teaching? A. I should wear a mask in common areas. B. I can share nebulizer equipment with my sibling who also has CF. C. I should wash hands frequently. D. I need to avoid close contact with other CF patients. Answer. B. I can share nebulizer equipment with my sibling who also has CF. Rationale: cross-infection between CF patients is dangerous due to resistant organisms. Masking, hand hygiene, and avoiding close contact are correct. Question 24. A hospitalized CF child receiving IV antibiotics develops diarrhea and abdominal cramping. What complication should the nurse suspect first? A. Cystic fibrosis, related diabetes. B. Antibiotic-associated Clostridioides difficile infection. C. Lactose intolerance. D. Pancreatic enzyme deficiency. Answer. B. Antibiotic-associated Clostridioides difficile infection. Rationale: antibiotic therapy increases C. diff risk, presenting with diarrhea and cramps. A causes hyperglycemia. C and D cause malabsorption, not acute diarrhea post-antibiotics. Question 25. A CF client awaiting lung transplant refuses chest physiotherapy due to fatigue. What is the nurse's best action? A. Respect refusal and document. B. Explain that airway clearance is critical to remain eligible for transplant. C. Offer to administer extra pancreatic enzymes instead. D. Delay physiotherapy until discharge. Answer. B. Explain that airway clearance is critical to remain eligible for transplant. Rationale: adherence to pulmonary hygiene is vital for transplant candidacy. Nurses must advocate while respecting autonomy. A alone risks harm. C is irrelevant. D delays essential care. Question 26. Which nursing intervention takes highest priority for a CF client with new hemoptysis of 200 milliliters in 24 hours? A. Encourage aggressive chest physiotherapy. B. Place the client on bed rest and notify provider. C. Continue routine exercise to mobilize secretions. D. Give pancreatic enzymes with meals. Answer. B. Place the client on bed rest and notify provider. Rationale: hemoptysis greater than 100 milliliters in 24H is significant and requires rest to prevent worsening, with urgent evaluation. A and C increase bleeding. D is unrelated. Question 27. A CF client is on high-dose pancreatic enzyme replacement. Which finding requires the nurse to question therapy safety? A. 2 to 3 soft stools daily. B. Elevated uric acid and painful joints. C. Weight gain of 2 pounds. D. Improved fat absorption. Answer. B. Elevated uric acid and painful joints. Rationale: High-dose enzymes can cause fibrosing colonopathy and hyperuricemia. A, C, and D are expected benefits. Question 28. During an annual checkup, a CF teen has HbA1c of 7.5%. What is the most appropriate interpretation? A. Client has CF-related diabetes and requires management. B. This level is normal for CF and requires no action. C. This is caused by pancreatic enzyme therapy. D. This is expected only in infection and can be ignored. Answer. A. Client has CF-related diabetes and requires management. Rationale. HbA1c greater than 6.5% indicates CFRD, requires insulin therapy. B is incorrect. CF doesn't alter the threshold. C and D are false explanations. Question 29. The nurse is reviewing airway clearance therapy with parents of a 2-year-old with CF. Which statement requires correction? A. We should do chest physiotherapy before meals. B. We'll give bronchodilator inhalation before chest physiotherapy. C. We can skip physiotherapy if our child looks fine. D. We should perform physiotherapy 1 to 2 times daily. Answer. C. We can skip physiotherapy if our child looks fine. Rationale. Airway clearance is daily regardless of symptoms to prevent exacerbations. A, B, and D are correct teaching points. Question 30. Which finding requires the nurse's immediate intervention in a hospitalized CF client on IV antibiotics? A. Blood glucose 110 mg per deciliter. B. SpO2 88% on 2L nasal cannula. C. Mild abdominal distension after eating. D. 3 soft stools per day. Answer. B. SpO2 88% on 2L nasal cannula. Rationale. Hypoxemia is life-threatening and requires immediate intervention. A, C, and D are expected or manageable findings. Question 31. A school nurse cares for a CF student prescribed pancreatic enzymes. Which action is correct? A. Administer enzymes at least 1 hour before meals. B. Give enzymes immediately before every meal and snack. C. Crush the enzyme capsule into liquids for easy swallowing. D. Give enzymes only with large meals, not snacks. Answer. B. Give enzymes immediately before every meal and snack. Rationale. Pancreatic enzymes must be given right before meals or snacks. A is too early. C destroys enteric coating. D reduces absorption. Question 32. A CF adolescent hospitalized for pulmonary exacerbation asks why they cannot have visitors with colds. What is the best nurse response? A. You can have visitors, but only if they wear gloves. B. Even minor respiratory infections can become very serious for you. C. We need to protect other patients, not just you. D. Your immune system is too weak to handle any visitors. Answer. B. Even minor respiratory infections can become very serious for you. Rationale. Clear teaching links infection prevention to CF severity. A and C are misleading. D overgeneralizes immune status. Question 33. A CF client is prescribed Dornase alpha. Which assessment best indicates effectiveness of therapy? A. Decreased viscosity of sputum and improved airflow. B. Increased sputum purulence and fever. C. Weight loss with diarrhea. D. Decreased pancreatic enzyme requirement. Answer. A. Decreased viscosity of sputum and improved airflow. Rationale. Dornase alpha breaks down DNA and mucus, thinning secretions. B indicates infection. C and D are unrelated. Question 34. A CF adult awaiting lung transplant develops increasing depression and withdrawal. What is the nurse's best first action? A. Encourage open discussion and assess for suicidal ideation. B. Notify the transplant coordinator to remove the patient from the list. C. Offer sedatives to relieve anxiety. D. Ignore until after discharge. Answer. A. Encourage open discussion and assess for suicidal ideation. Rationale. Mental health screening and support are essential. Depression impacts adherence and transplant eligibility. B. C, and D are unsafe. Question 35. Which interdisciplinary collaboration is most critical during CF-related diabetes management? A. Speech therapy. B. Endocrinology and nutrition services. C. Physical therapy. D. Social work only. Answer: B. Endocrinology and nutrition services. Rationale: CFRD requires insulin therapy and specialized nutrition management. A, C, and D may help but are not central to diabetes control. Question 36. The nurse evaluates CF clients' teaching on nebulized antibiotic therapy. Which statement shows correct understanding? A. I will take the antibiotic inhalation before bronchodilators. B. I should take the bronchodilator first, then airway clearance, then the antibiotic. C. I can change the order depending on convenience. D. I will skip antibiotics if I feel well. Answer: B. I should take the bronchodilator first, then airway clearance, then the antibiotic. Rationale: correct sequence optimizes airway opening and drug delivery. A is incorrect order. C and D risk poor outcomes. Question 37. During hospitalization, a CF adolescent insists on managing their own chest physiotherapy. What is the nurse's best response? A. Refuse and explain only staff can perform it. B. Allow independence while supervising technique. C. Permit full independence without checking technique. D. Delay until family arrives. Answer: B. Allow independence while supervising technique. Rationale: adolescents need autonomy, but require supervision to ensure effectiveness. A discourages independence. C and D risk ineffective therapy. Question 38. A CF client's sputum culture grows Burkholderia cepacia. What is the nurse's priority action? A. Place client on strict contact precautions. B. Continue routine care with standard precautions only. C. Cohort with another CF patient with the same organism. D. Discharge the client to prevent spread. Answer: A. Place client on strict contact precautions. Rationale: B. Cepacia is highly resistant and transmissible. Strict precautions required. B alone is insufficient. C is unsafe. D is inappropriate. Question 39. A CF child hospitalized for pulmonary exacerbation refuses to participate in airway clearance due to pain. What should the nurse do first? A. Withhold therapy until the child agrees. B. Administer prescribed analgesic and then attempt therapy. C. Restrain the child to ensure therapy completion. D. Skip treatment until the next day. Answer: B. Administer prescribed analgesic and then attempt therapy. Rationale: pain management improves cooperation and effectiveness. A, C, and D compromise care or harm the child. Question 40. A CF adolescent nearing end-stage disease expresses a wish to stop treatments. What is the nurse's best initial action? A. Initiate immediate palliative care referral and facilitate discussion with client and family. B. Refuse to discuss and continue treatments. C. Tell the family to override the adolescent's decision. D. Discharge the patient without support. Answer: A. Initiate immediate palliative care referral and facilitate discussion with client and family. Rationale: respecting autonomy with palliative care support ensures dignity and shared decision-making. B, C, and D disregard ethical and supportive care.
If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.